If you're dealing with wrist pain that just won't quit, you are in exactly the right place. We're about to break down what's really going on inside your wrist and, more importantly, lay out a clear plan to get you feeling better. Let's dive right in.
So you've got that nagging, aching, maybe even sharp pain in your wrist, and you've probably told yourself, it's just a bit of tendonitis. But what if I told you that for most wrist issues, that's not really the whole story?
All right, first up, let's take a look inside your wrist. We need to understand the real story behind what's causing all that discomfort.
You know, we hear the word tendonitis thrown around all the time for any kind of joint pain, right? And look, it's a decent starting point, but the anatomy of your wrist is, well, it's a bit more complicated, and that means the problem is usually a bit more specific.
So let's get our terms straight. Tendonitis is exactly what it sounds like. Inflammation of the tendon itself, that tough, ropey cord that connects your muscle to your bone. It's a super common problem in places like your Achilles tendon or your biceps. But the wrist? It's a different ballgame. See, the real culprit in most cases of wrist pain is actually a condition called tenosynovitis. Notice the difference? It's not the tendon that's the main problem, it's the protective sheath that wraps around it. And this is an absolutely crucial distinction because our focus needs to be on that sheath.
Okay, here's a perfect way to picture this. Think of your tendon as the copper wire inside an electrical cable. That wire is surrounded by a slippery protective sheath. That's the plastic insulation. With tenosynovitis, it's that insulation that gets all inflamed and sticky, which stops the wire from gliding smoothly like it's supposed to.
So what causes this mess in the first place? Well, in pretty much every case, the answer is simple: overuse. We're talking hours spent typing and clicking, intense gaming sessions, knitting or writing, playing sports like tennis, even lifting weights with bad form. It's these repetitive movements that overload that tendon sheath and spark the inflammation. Do any of these sound a little too familiar?
All right, so now that we know what the problem is, let's figure out where it is. It's time for you to become your own detective and really pinpoint the source of the pain.
Here are the clues you need to look for. First, a dull ache that's right on top of the tendon. Then, maybe some sharp stabbing pains when you try to move your wrist. You might also see swelling, but it's very localized. It's not your entire wrist that's swollen. You might even feel a really weird creaking or popping sensation. Doctors have a fancy name for it, crepitus. And of course, it's tender if you press right on that spot.
Now, to get even more specific, doctors often divide the wrist into 6 distinct zones. 3 on the back of your hand, 3 on the palm side. By figuring out which of those 6 zones is hurting, you can get a really good idea of which specific tendon is angry with you. We're not going to go through all 6 today, but we are going to talk about the most common one.
And this is fascinating. By far, the most common type of wrist tenosynovitis hits the tendons on the thumb side of your wrist. It's so common, it's got its own name, de Quervain's tenosynovitis. It even has a nickname, mommy thumb, because it so often affects new moms from, you guessed it, repeatedly lifting their babies.
Okay, you've done the detective work and identified the problem. Now, we get to the most important part. What do you actually do about it? Let's walk through your path to recovery step by step.
Phase 1 is all about self-care, and step 1 is completely non-negotiable. You have to rest. You've got to reduce or stop the activity that's causing the pain in the first place. Next, getting an immobilization splint can be a total game changer, especially if you wear it at night. It keeps the area still so it has a chance to heal. And finally, you want to attack that inflammation with something like an over-the-counter anti-inflammatory pill, a topical gel, or even just a simple ice pack.
Now, this is a really important timeline to keep in your head. If you've been doing all this self-care stuff diligently for about 6 weeks and you're still not seeing a real improvement, that's your sign. It's time to stop guessing and go see a professional. So what can a pro do that you can't? Well, they might run some blood tests just to rule out other issues like diabetes or gout. They can also use an ultrasound to get a live look at what's going on. And what they're looking for is pretty cool. It's called the bullseye sign. They'll see a white dot, which is the tendon, surrounded by a black ring of fluid. It's a dead giveaway for tenosynovitis. From there, a cortisone shot can provide powerful targeted relief, and surgery, that's really just a last resort for very rare stubborn cases.
Look, getting out of pain is one thing, but staying out of pain, that's the real goal, isn't it? So let's talk about the long-term plan to keep your wrists happy and healthy for good.
When you boil it all down, preventing this from happening all over again comes down to a fundamental choice. You really have two main paths you can go down.
Your two choices are pretty simple, actually. Choice 1, you modify the activity that's causing the strain. Or, choice 2, you build up your wrist's strength and resilience so it can handle that activity better. So you can either reduce the load or you can increase your capacity to carry it. The best solution is often a little bit of both.
So if you go with option 1, modifying the activity, think about practical, real-world changes. This could mean getting a proper ergonomic assessment of your desk setup, maybe switching to a vertical mouse or a split keyboard. If you're an athlete, you could work with a coach to tweak your technique. It's all about finding ways to reduce that repetitive strain.
Now, if you're going to go the strengthening route, timing is everything, and I mean everything. You can only start these exercises after the pain and inflammation have totally settled down. If you try to strengthen an angry, inflamed wrist, you're just going to make things so much worse. You have to start gently, progress very, very slowly, and be patient. A proper strengthening program isn't a quick fix. It's going to take at least 3 months.
So, as we wrap this up, I want to leave you with this one thought. Our wrists work so hard for us every single day without us even thinking about it. So the real question is, are you working for them? Because being proactive is the absolute key to staying pain-free for the long haul. Thanks for tuning in.